Okay, welcome back. I hope you're all having a great week. Today, we're continuing our RBT exam practice question series, where we're going through RBT exam practice questions and breaking them down, how you should think about them on the real exam. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for our proven study materials, please check out rbtexamreview.com. We offer 3 full practice exams, our task list study guide, our combo pack. It's our best deal. It comes with everything and flashcards, and of course, our competency study guide as well. Congratulations to everyone who's passed recently. We're going to do a shout out this coming Sunday. So when you do pass, please let us know. Other than that, any questions you have, please let me know, email me, or leave a comment. Study hard, work hard, and let's get to our questions. Question 1. You text your supervisor to check in and see if there is anything specific they would like you to work on a session today. They ask you to find out if the client can dress themselves. What are you going to do at session? When we want to find out if someone can or can't do something, what do we do? It's a very simple procedure. It's a one-word answer. And in this case, your supervisor wants to know, can the client dress themselves? Can they not? We're not intervening. We're not taking data. We just want to know, can they do it? Can they not? So what are you going to do? Are you going to do a functional analysis? A functional analysis is the best way to determine the function of a behavior. However, RBTs do not perform functional analysis on their own. BCBAs run functional analysis, which involves manipulating antecedents and consequences. In this case, we're going to do something much more simple than that. Okay, we just need to know, can they do it? Can they not? If we look at B, probe, that's more like it, right? We're going to probe this skill. When you probe something, you simply say, get dressed, or put on your shirt, or put on your pants. And then, can they do it? Can they not? Very simple, okay? Probing is one of the first steps in all of our skill acquisition plans, right? To know where we start, okay, we have to know where the client is at skill-wise. Probing helps with that. B looks like our answer. Let's read all of the answer choices and find out why the other ones are wrong. What about an indirect assessment? Indirect assessment is not going to be the best way to determine if the client can or can't do something. If we ask a parent, can your son dress themselves? And the parent says, yes. And then we go in the room and ask the son to dress themselves and they can't do it. Was that indirect assessment useful? No, right? Because based on our probe, they couldn't. So we really want to use a direct assessment when probing. And then a preference assessment. We're not determining what the client does and doesn't like. We're looking for a skill. So we are going to do what? We're going to be probe. If you were deprived of water and wanted some, but no water was available, what would be present and what would not be present? Kind of a confusing question, kind of a tricky question based on the wording, okay? This is going to be an MO and an SD question, right? And what the question is asking is, what is present in the situation? Is an MO present? Is an SD present? Are both present? That's what we're going to determine. So what is an MO? An MO increases or decreases the value of a consequence. It basically makes you want or not want something. An SD signals that consequence is available. It is telling you, yes, you can have access, or if there's no SD, then there is no access. Okay. So in this case, if you were deprived of water and wanted some, would an MO be available? Absolutely. Deprivation leads to an MO, leads to an establishing operation for water. Water increases in value due to deprivation. So an MO is definitely present. However, no water is available. Is there an SD signaling water is available? No, because it isn't. That is the key difference. So in this case, we have an MO, but not an SD. That's what we're looking for in our answer choice. So A, an MO and an SD would be present. Well, we know that's not true. We just found out why, right? You want the water, but it's not available. There is no SD. B, an MO, but not an SD would be present. Yes, that is what we determined after analyzing the question. B looks like our answer. What about C? Neither an MO or an SD would be present. The MO is present. You're deprived of water. Water increases in value. D, not enough information. We have plenty of information to answer this question. Our answer is going to be B. An MO, but not an SD, would be present. Just now, I went downstairs to make coffee. Once I hit the start button, it takes 5 minutes for the coffee to be done. I take care of a few things until I hear the beep, and then I pour the coffee into a cup. What type of schedule is receiving coffee on? Coffee is our reinforcer in this situation. We're looking at basic reinforcement schedules, FRs, BRs, FIs, BIs. And when you do a basic reinforcement schedule, at least when you're starting out, break it down. So ask yourself, am I dealing with a certain amount of responses or am I dealing with a certain amount of time? In this case, it's taking 5 minutes for the coffee to be done. We're dealing with time. If we're dealing with time, which one of these can we eliminate? We can eliminate ratio schedules. So A and B are out. We're not worried about how many responses. We're worried about the time. So if it takes 5 minutes for the coffee to be done, and it's going to take 5 minutes for that coffee pot, it's very consistent to make the coffee. Is that a fixed time interval or is that a variable time interval? Well, since it's 5 minutes every time, it's going to be fixed. Variable is on average. So if I said, once I hit the start button, it takes anywhere from 4 to 6 minutes for the coffee to be done, that will be variable. And then with an FI, a fixed interval 5 minutes go by, and after the first response, after the 5 minutes, you're reinforced, which is what occurs in this case. 5 minutes pass, I then hear the beep and pour the coffee into a cup. I receive reinforcement. The key is, I'm not going to get reinforcement, though, until 5 minutes has passed. That's the thing with the interval schedule. No matter how many responses you engage in, until that time passes, no reinforcement will be delivered. That is really the essence of an interval schedule. So what type of schedule is receiving coffee on? D and FI 5. When someone asks for a head count on how many people are at an event or in a certain place, they're really asking for the what? Pretty straightforward measurement question. I've been getting a lot of measurement questions lately, so I've been trying to do more measurement questions. Okay, I find that once you get measurement down, it's very simple, but I guess it's more difficult to learn, right? It makes sense. Okay, if you've never measured things in your life, it's a kind of a difficult concept. So let's just talk about this one. When someone asks for a head count, what are we getting? What are we doing? Well, we're typically counting how many people are there, right? When you're counting, what are you getting? Are you looking for frequency? Absolutely. Frequency is just a count. It's the same exact thing. A looks like our best answer, but what about B, rate? What is rate? Rate is going to be frequency with the time component added. Now, rate is typically more accurate than frequency. But in this case, do we really need to be as complicated as rate? No, we just need a count. If you're just counting, just use frequency. It's much easier, right? So A looks like our best answer. What about latency or IRT? Well, since we're not dealing with time, we don't need latency or IRT. Latency is time in between the SD and the response. There's no responses here. There's no SDs, right? We're just counting people. And then IRT is the time in between two responses. We're not timing any responses. Again, it's just a count. Don't overcomplicate it. If you're looking for a head count, you're simply looking for frequency. Jay is playing a carnival game that requires him to hit a plastic moles with a hammer as they pop out of holes. Jay must hit them as fast as possible once they pop out of the hole. Jay is concerned with what? When you get behavior questions, start to figure out what is my response, what is my SD, etc. It's going to help you. In this case, Jay hitting the mole is the response. The mole popping out of the hole is the SD. So if Jay wants to hit the moles as quickly as possible, what must he do? He needs to respond to that SD as fast as possible. And the time in between the SD and the response is what? Is that frequency? Well, if we were counting how many moles Jay hit, that would be frequency. We're not worried about that. We're worried about how fast he's hitting them. So IRT would be what? Into response time. Are we worried about the time in between strikes? No, we're worried about the time in between or how fast it takes Jay to react to them popping out of the hole. And that's a very important distinction. Popping out of the hole is the SD. Hitting them is the response. So if we were timing in between hits, that would be IRT. But we're timing from the SD to the response. So really, we're recording latency. Duration, we're not timing how long Jay is playing. We're simply timing from the SD of popping out of the hole to hitting them. SD to response, it's going to be C. latency. During training, your BCBA tells you and the other RBTs that you should always speak on the client's level and engage them in age and skill appropriate activities. The BCBA is trying to guarantee that what? So I see it all the time where we'll have clients who might be older, but skill-wise, they're on a lower level. We might have clients who are younger, but skill-wise, they're on a higher level. When we're working with, and this is for typically autism, because most of you are going to be working with autism. When we're working with autism, we have a wide range of age and skill. We're not teaching to age necessarily. We really want to teach to skill, okay? And then I could guess peer appropriate things, right? If you have a 15-year-old client who really is more skill-wise at 6 or 7, that needs to be taken into account. And then when you're speaking on the client's level, you're talking to them like you would talk to any other person. So if I've got a 16-year-old who can communicate, I'm going to talk to them like a 16-year-old and not a little kid. When you're doing these things, what are you ensuring? Are you avoiding door relationships? Well, no, we're not worried about the door relationship here. A door relationship is when you cross a professional to a personal relationship. In this case, we're trying to be more professional. We want to be as professional as possible so that we what? So that we maintain client dignity. Above all else, we want meaningful outcomes. We want to maintain dignity. Respect the client. Treat them like you would treat anyone else. Treat them to their age, their level, and their skill. What about avoid engaging in unauthorized activity? I mean, maybe, but speaking on the client's level or engaging them in inappropriate skill level activities isn't necessarily unauthorized. It's just not maintaining the best dignity. And then D, you're taking good data. You're not taking data in this case. We're simply talking about the idea of delivering as much respect and dignity to the client as possible. So when the BCBA is telling you to do all of these things, speak on the level, engage them in age and skill appropriate activities, the BCBA is trying to guarantee that you will maintain client dignity. Client's parent is in a panic whenever you arrive at your session. Client's parent tells you in the BCBA that the client is now hand flapping all day, every day. They want advice on how to manage the behavior. The BCBA tells them to provide an edible reinforcer when the client is not hand flapping. The BCBA wants the parent to use what? First things first, whenever you get to a session and a parent is in a panic or they're frantic or they're upset, you should remain calm. Okay, we need to be the ones maintaining a cool head. We don't need to feed into the panic. Things happen, behaviors change. It might happen to you, okay? But we need to try to remain calm. Now, to the question. This is an intervention question. What type of intervention does the BCBA want the parent to use? As you notice, before we get to our answer choices, we're breaking down the question. You need to spend time on the question, breaking it down, and learning as much information as you can before actually going to the answer choices, because all the information you need is in the question. That's how you're going to answer the answer. So the BCBA wants the parent to use what? Well, the BCBA tells them to provide an edible reinforcer when the client is not hand flapping. What intervention do we provide reinforcement in the absence of a behavior or when a behavior is not occurring? Is it a DRA? Well, the DRA, we do put something on extinction, but we're also reinforcing in the presence of a replacement behavior. In this case, there is no replacement behavior. We're not going to pick DRA. What about a punishment? Well, in the question, it says reinforcer. So we're not punishing this behavior. We're reinforcing other behaviors. And that's the key, because when we look at DRO, a DRO is a differential reinforcement of other behaviors. We reinforce other behaviors and not the target. The target here is hand flapping. Anytime they're not hand flapping, we're going to reinforce. It's the key. If you were to speed through this question, you might pick punishment and skip this reinforcer word altogether. Now, what about extinction? Okay. Yes, we are putting the behavior on extinction, but differential reinforcement is just a procedure that involves extinction. So extinction is good, DRO is better. We need the best answer. And with DRA, hand flapping is on extinction, we're reinforcing Any other time, it's not happening. What's the difference between DRO and DRA? With DRA, we're picking one specific replacement behavior and reinforcing that. With the DRO, we're reinforcing anything that's happening that's not hand flapping. So what does the BCBA want the parent to use? C, DRO. What is wrong with this statement? The student is constantly talking in class. If we take away stars from a star chart when he talks in class, the negative reinforcement will hopefully prevent the talking. Don't go to the answer choices. Think about the question. What is wrong with this statement? What are we doing? Student is constantly talking in class. We are taking away stars from a star chart. So is that negative or positive? That is negative. So far, so good, right? We are using a negative procedure. But now it's saying the reinforcement will prevent the talking. Does reinforcement decrease or prevent? No, reinforcement increases. So what's wrong with this statement? Well, reinforcement doesn't prevent the talking. This is more like a punishment procedure. This looks like a response cost to me, right? Which is negative punishment. So now that we think we know our answer, let's get to the answer choices. A, we don't take away earned reinforcers in ABA. Well, of course we do. We use response cost. Okay, it's a very valid and approved method, especially during token economies. B, this is positive punishment, not negative reinforcement. What do we say? We said this was negative. We're taking something away. It's just not reinforcement. So B is wrong. It's not positive punishment. C, this is positive reinforcement. We'll stop right there. We definitely know this isn't positive reinforcement, right? So D, negative punishment, not negative reinforcement. Yes, we're taking something away in order to try and decrease the behavior. We're using negative punishment, not negative reinforcement. Another way to describe the intensity of a behavior would be to describe the what? Would we be describing the function, the topography, the magnitude, or the form if we're describing intensity? Let's go through them. Function, what is function? Function is the most important thing that an RBT needs to know. Why is the behavior occurring? Why does it happen? Attention, escape, tangible, automatic. Function, not what we're describing. Topography, how the behavior looks. Okay, this is describing, if I'm describing someone hitting, I would say closed fist, swinging arm. That is the topography. Now, topography and form are basically the same exact thing. It's how the behavior looks. We're looking for intensity. So is it loud? Is it soft? Is it hard? Is it weak? That is intensity. And another way to describe the intensity will be describe the magnitude. Something you need to know, okay? Something you need to be familiar with. Behavior has function, behavior has topography and form, and behavior has magnitude. Okay, hope you enjoyed. Please like and subscribe. Check out rbtexamreview.com for all of our study materials. Questions, comments, let me know. Other than that, work hard, study hard. See you soon.